required for dorsiflexion and plantar flexion. So this is a component motion that's lost, that people don't really talk about, the medial and lateral glide, and it's highly effective because just that small bit amount will help you to restore that motion. Pushing posterior and anterior is great because you know you need it, but there is a slight medial and lateral. So what we're going to do here is we're going to find the talus. Okay, so you make sure you wiggle her around a little bit. You should feel movement. Now, you need to figure out, okay, she's limited in dorsiflexion or plantar flexion, so that's going to tell you which way are you going to move her. Don't move them where you know that they can get to, right? She might be stuck both directions, in which case she'll do medial and lateral, okay? But I'm going to just find the talus, and all I'm going to do, I try to stabilize the foot here, and my thumb is the mobilizer with my finger, and I just gently apply a medial glide. I mean, it's so gentle, it's light. Feel where the barrier is. You can turn this into an easy mobilization. I can do it grade 3 or 4. Getting to the end range or backing out, going in, backing out, going in. Okay, so I just restore that glide. If you want it, you can use both thumbs to help push you, but you got to make sure that you're not just doing that, right? You have to be on the talus, gliding the talus medially, or it will be gliding the talus laterally. So again, you find her, and then I just push that talus medially. Okay, it's super easy, easy access, and I just make sure I'm moving the talus. Does that make sense? With these, there's not a huge amount of motion, so don't feel like it's going to keep going. It's just a little bit. But you will know when you hit up against a barrier. It just won't go. It's not going to move. It feels like a brick wall. You're going into a brick wall. And as your fingers and your palpation skills get really advanced, you're going to really start to pick it up.